There's some big announcements about Medicaid this week, and they're not all terrible. I know. This is Healthcare Triage News. A number of states have been working on trying to get lifetime limits imposed on Medicaid. And if you follow me on Twitter, you know this caused me to nearly lose my mind a couple weeks ago. That's because Medicaid is an insurance system of last resort. It covers the poorest among us. It covers those who are often too disabled or sick to work. It's not cake. It reimburses your physicians when you get care. You can't sit at home and live high on the hog on Medicaid. Moreover, taking away someone's insurance doesn't incentivize them to not be sick anymore. My ulcerative colitis isn't hanging around just because I've got insurance. Anyway, this week Seema Verma and CMS announced they will not approve Kansas's request to impose lifetime limits on Medicaid. They wanted to cap people's eligibility after 3 years. 3 years for a lifetime! Approving this would have been a tectonic shift in entitlement programs for everyone, and it could have had huge effects. That it didn't get approved is likely disappointing for states like Utah and Arizona, which were considering similar changes to their programs. Of course, Kansas can still institute work requirements, which we've discussed before. You may have also seen some news this week on states getting those up and running. In Michigan, for instance, policymakers are trying to get a plan together that requires work-eligible people to work or at least prove they searched for work at least 29 hours a week to get Medicaid. But they want to exempt people who live in counties with high unemployment rates, say 8.5% or higher. A number of people have pointed out that predominantly white rural counties will be exempt from the work requirements, but urban communities with more African Americans will not. Governor Rick Snyder has not been very supportive of the plan, which means it may not pass. But these things, as with everything in healthcare, are complicated. We have to make sure that what we're doing doesn't have negative consequences. Other states have gotten work requirements approved, and we'll have to keep watching how they're implemented. Kansas is looking for one, too. Because they didn't put in a Medicaid expansion, they're stuck in this weird world where very poor people need to get work to get Medicaid, but if they earn just a little money, then they're too rich for Medicaid. I have no idea how they think this is gonna work. But for the moment, Medicaid advocates can breathe a sigh of relief that the Trump administration seems to have found a line they won't cross in cutting people off from their Medicaid. Do you like the show? Really helps if you subscribe or like us right down there. And while we've got you, another good way to support the show is a subscription service called patreon.com, which allows you, the viewer, to donate even as little as $1 a month to help make this bigger and better. It's always gonna be free, but any support you might be able to give us, we really appreciate. Go to patreon.com/healthcaretriage. We'd really like to thank our research associates, Joe Sevitz, Carlos Hiergos, Crafty Geek, and of course our Surgeon Admiral Sam. Also, while we've still got you can check out merch at hctmerch.com. There's lots of great stuff there. You can go to our Facebook page or our Reddit, listen to the podcast, and of course my book, The Bad Food Bible, still on sale everywhere. Appreciate it if you bought a copy.